Welcome to the Healthcare Compliance Pros June 2017 Corporate Compliance webinar. Today we'll be presenting requirements for your corporate compliance program. The presentation is being recorded. This recording will also be published in our Insider newsletter next week and will also be available on your compliance website landing page under News and Events. At this time, I'd like to introduce the presenters for today, Michelle Lyman and Chad Schiffman. Michelle is our operations manager. She serves on the front lines in supporting clients with website management and compliance basics. She's also involved with product and article development for HCP. Many of you have had the pleasure of working with Michelle. Chad is our director of compliance and is an expert on compliance law. Chad and his team consult with our clients on compliance issues. He is a published author and a regular contributor to our weekly Insider articles and also product development. He is a security risk analysis specialist and has a background in healthcare informatics and administration. If you have questions during the webinar, please post them using the GoToWebinar dashboard so we can address them during the presentation. Any questions that we are not able to address during the webinar will be followed up via email. Now I'll turn the webinar over to Chad and Michelle for today's presentation. Michelle?
Thanks, Nicole. As an introduction, Chad and I wanted to go through the ABCDs of Medicare just to introduce our topic for the day. So let's just take a look at the slide that Nicole's showing you now. Original Medicare is administered directly by the federal government and is the way most people get their Medicare, and it has two parts, Parts A and B. Part A is hospital insurance and covers most medically necessary hospital, skilled nursing facility, home health, and hospice care. Part B is medical insurance, which covers most medically necessary doctor services, preventative care, DME or durable medical equipment, hospital outpatient services, lab tests, x-rays, mental health care, and even some home health and ambulance services. Now let's look over at Part C. Part C is interesting because it's not a separate benefit. Part C is the part of a Medicare policy that allows private health insurance companies to provide Medicare benefits. So these Medicare private health plans, such as HMOs and PPOs, are known as Medicare Advantage plans. I'm sure that is a familiar phrase to most of you. If patients want, they can choose to get their Medicare coverage through a Medicare Advantage plan instead of through original Medicare. And these Medicare Advantage plans must offer at least the same benefits as the original Medicare, or those covered under Parts A and B, but can do so with different rules and costs and coverage restrictions. Patients also typically get Part D as part of their Medicare Advantage benefits package. But let's talk about Part D on its own for just a minute. This is the outpatient prescription drug insurance, and it is provided only through private insurance companies that have contracts with the government. It's never provided directly by the government like original Medicare, and providers that contract with Part D are generally retail pharmacies.
Yeah, hey, thanks, Michelle. Thanks for sharing that. Y'all may be sitting here wondering why we feel it's so important to talk about, being aware of the different parts of Medicare. And, one of the main reasons why is we have several clients who aren't quite sure which corporate compliance training they need to be offering or which policies and procedures they may need to have in place for their organization. And so we feel nailing down which parts of Medicare you're contracting with is a very important first step in establishing your entire compliance program. So, with corporate compliance, it's really the only way that you're going to be aware of what training you need to offer for your particular organization. Now, for example, one of the questions that we receive on a regular basis is, regarding plan sponsors. That's been a real frequent question for us lately.
Yeah, and I'm glad that we're going to talk about this today because being on the front lines and talking to our clients on a daily basis, we do get some questions about this. And I'm sure that many of us on the webinar today couldn't say off the top of our head exactly what a plan sponsor is. So Chad's going to help us with that.
Yeah, so according to CMS, a plan sponsor is the health insurance company who contracts with CMS to provide Part C or D benefits. A provider or a medical practice is not considered a plan sponsor. That's often confused by many practices, but it's always the insurance company. Instead, as a provider or providers, they fall under what CMS refers to as the first tier, downstream, or related. FDR entities.
All right, so now we're going to take just a few minutes and look at that relationship that providers and medical practices have with those plan sponsors. So I'm just going to actually read the slide that we're on because this is an important part of the webinar that you need to understand. So we're going to look at that first tier area first. So first tier entities contract directly with Part C Medicare Advantage organizations, and they are referred to as MAOs, or Part D prescription drug plans, which are referred to as PDPs, to provide their services. And now we get to the second part of this acronym. So we've covered the F. Now we're going to look at D and R, which are downstream and related entities. And these downstream and related entities contract with first tier entities to provide additional services.
Yeah, so like Michelle said, FDRs, they are your medical providers and practices and entities that contract with Part C and Medicare Advantage organizations or Part D prescription drug plans to provide services. Yeah, and this is where it comes in, because you'll see or may have heard, of insurance companies asking for attestation that you've actually completed a fraud, waste, and abuse and general compliance training. I'm sure a lot of you on this call have received those letters that say, hey, now it's time for you to attest, saying, have you completed your fraud, waste, and abuse training as required by CMS or something along those lines? Click here, check this box. Or you may have had multiple plan sponsors ask you for attestations on completing this training. And if you haven't done so, they may request you take the training that they offer from that particular plan sponsor. Now, I don't know about you, but can you imagine taking fraud, waste, and abuse and general compliance training for each sponsor you contract with? That could be a lot of training. So let's go ahead and take a look at a few scenarios and just kind of take exactly how CMS determines who should be taking which training and who may be exempt for certain, but not all, training requirements that CMS requires.
All right, so here's the bottom line. According to CMS, Medicare Advantage and prescription drug plan, or those Part C and D sponsors, they're the ones that get to decide what corporate compliance, fraud, waste, and abuse training those first tier downstream and related entities are. Again, those are referred to as FDRs. So they are deciding which training those FDRs must take to ensure compliance with their plan. And I think Chad might be muted. Chad, are you?
Yeah, I am so sorry about that. My microphone
fine.
will do that from time to time. Yeah, so pretty much in the past, what happens is Part C and D sponsors were allowed to, FDRs basically could take training that consisted of content provided by CMS, but they weren't required to take a uniform content. But then in 2016, or as of January 1st, 2016, CMS decided to require completion of corporate compliance and fraud, waste, and abuse training for all employees of FDRs. And with this, they required the training not to be modified. So they wanted to ensure the integrity and competencies of the training were basically as they wanted it to be. So what they decided to do is they said, okay, FDRs can upload this training into the platform of their choice. And this is why we've offered, and from that day forward, we offered that training, and then why a lot of you might be taking that CMS corporate compliance training module we offer to all of our clients.
Yeah, that's been a great course to have to share with our clients. I think that was a big question for many of them, is how are we going to access that CMS required training? So I'm glad we've been able to provide that. Now we're going to switch over to our next slide and take a look at entities who only work with Medicare A and B. So Part A and B providers have already met the requirements for fraud, waste, and abuse training. However, they need to keep this in mind. They still need to meet the CMS requirements for general corporate compliance training. And this is a piece of the puzzle that sometimes gets overlooked. Our online training platform includes a traditional corporate compliance training module with general compliance training and fraud, waste, and abuse training. So this meets and exceeds your CMS requirements. Some of our clients leave the course exactly how we've presented it, while others focus on the general corporate compliance portion only. Really, the beauty of this module is that it's customizable, just like all of our courses, and you can customize it to meet your organization's needs.
Yeah, so I think at this point, it's a good idea to go ahead and talk about this at least one more time. What we want to just make sure you understand is that according to CMS, organizations that contract with only parts A and B do not need to take the C and D training, or the Medicare C and D training, which is that CMS version that is unmodified. But that's not to say that you wouldn't want to consider general corporate compliance training. So, what you want to do is verify with your practice management compliance officer, and just to see if you contract with just parts A and B. However, what we've found is we expect very few providers would actually contract with just parts A and B, and that's what we found to be typical.
So we do have many clients who have said to us, hey, we only work with Medicare Parts A and B. And then we've asked them to, kind of take a deeper look and talk to their team and members. And then upon further examination, they've found that they also contract with Part C. So there has been some recent chatter online, and this is part of the reason that we decided to do this webinar today, because there have been some questions out there as to what compliance training these types of organizations must participate in. We really hope that as a participant in this webinar, you'll be able to come away with a good understanding of what the requirements are, and make sure that you're taking the right training or offering the correct training for your organization.
Yeah, and as part of that, a lot of you may have on this call may have heard of the DME POS. We receive questions about that quite frequently. Now, DME POS actually refers to accredited suppliers of durable medical equipment, prosthetics, orthotics, and supplies. DME POS are considered downstream entities.
And at this point, many of you may be asking what your requirements are if your organization contracts with Medicare Parts C or D and also works with Parts A and B, or A or B, or an accredited DME POS supplier. It gets a little bit confusing if you're participating with all of those Medicare parts.
Yeah, and that's where we find a lot of entities find themselves, and this is often where a deeming exception comes into play. But what's important to know about that deeming exception is it's for fraud, waste, and abuse training only, not general compliance training. So we want to emphasize that you'll still need to make sure that you have that general compliance training offered. Now, on a previous slide where we said according to plan sponsors, according to CMS, plan sponsors decide who must take the training. Sometimes insurance companies will still require training to be completed that includes fraud, waste, and abuse. And if this is the case, you should opt for the CMS corporate compliance training we offer our clients.
Thanks, Chad. Now, we've gone through a lot of detailed information, but we wanted to make sure that we reviewed the specifics again, just so that it sinks in and so you know exactly what we're talking about. And at this time, we will also open the webinar up to any questions. So if you do have some questions that you'd like to ask about your particular organization, go ahead and type them in the chat box, and we will address them as they come through. So Chad, do you want to start with Parts A and B?
Yeah, so once again, if you only contract or work with Parts A or B, you are not required to take the fraud, waste, and abuse training, but you should definitely offer general corporate compliance training to all of your employees.
And again, those organizations who are only working with Medicare Parts C and D, I'm just going to read this along with you, should offer the CMS version of the corporate compliance fraud, waste, and abuse training. Again, this is that training that cannot be altered. And as a reminder, this is the one that came online in January of 2016, where CMS required first-tier downstream and related entities, or our FDRs, to complete corporate compliance and fraud, waste, and abuse training for all employees of their organization and entities, or their providers, that they partner or contract with. So they have to provide those benefits or services. And CMS requires these FDRs who contract with Medicare's Part C and D to present the exact original content to ensure the integrity and completeness of the training. Again, we wanted to reaffirm that this is the training that we do offer on our website, that the training that is entitled CMS Corporate Compliance is that version of the CMS Medicare training that is required.
Yeah, and so like Michelle, well, we're going to go ahead and talk about organizations that talk with, or yeah, contract with Medicare Part C or D, and also work with Medicare Parts A and B or an accredited DME POS supplier one more time. Once again, this is where that deeming exception comes into play. That means fraud, waste, and abuse training under A and B would actually count for C and D. Remember, you'd still want to offer the corporate compliance training. And, you know, from CMS, they say, please know, FDRs have deemed to met the FWA training and education certification requirements through enrollment into Parts A and B of the Medicare program or through accreditation of supplier of DME POS are not exempt from the general training requirements. So that's why we offer both versions of the course to try to make sure that we have you covered. And it looks like we had a question come in, a couple actually. One of them talks about Medicare Part F, and I can just go ahead and tell you that that's actually a supplemental insurance plan, and it just covers Medicare Part B excess charges. So it's just supplemental plan that's basically above and beyond Part B. I believe it's also a high deductible option if I'm not mistaken, so that's what that is.
And then, Chad, do you see the question that says, is corporate compliance required by CMS only? If you do not participate with Medicare, are you required to take corporate compliance?
So it's a good idea to have a actual compliance program in place, and part of that, you know, some of the requirements are built into the compliance module. So we could look at that as a case-by-case basis and determine, hey, you know, some of the OAG requirements are also mentioned in there, so it might be a good idea to take a look at. But as far as the full program, no, you won't be required to take that training if you don't participate with Medicare. But if you do participate, receive Medicaid, there might be some requirements, you know, from your state level to take a fraud, waste, and abuse and the corporate compliance training. You'd want to verify with your state on that.
Okay. Let's see, the next one. Something, can you see the next question? I'm not sure if it's an actual question. I have all employees that have access to our EHR complete the HCP corporate compliance. I just have to say, good job.
Let's see, they do not have access to the EHR. Do you believe that? What does that say? I'm trying to read the rest of it.
Yeah, I'm trying to read the rest of it as well. I'm getting cut off just a little bit.
They do not have access to the let's see. I just want to make sure I get the rest of this question. I'm so sorry, it's not giving us the whole question, so we're trying to get to it here. Let me drag it out and see if I can get it there for them. Our compliance are our custodians. They do not have, okay.
So if we don't answer your question during the webinar, we will make sure that we answer all of them later on. I'm just trying to scroll down and see if we have any other questions that we haven't touched on. I think we've gotten them all, Chad. I've got a couple of personal questions that I'll finish.
Oh, no. I can actually see that. I can see that entire question now. Okay. So if they do, okay, so if they do not have complete access to the corp, or the ones that don't have access to your EHR aren't taking corporate compliance training, that would be perfectly fine unless you've got some policies and procedures that are built into there. Like, let's say you need to have your grievance policy put in there as one of the policies that they train on. There might be specifics that you want them to train on. You know, it could be one of those scenarios where you don't want them to do the fraud, waste, and abuse, but understand who to talk to. So technically, no, they wouldn't be required to actually take the full training, but it can't hurt to have them at least take that corporate compliance section at that point. So,
thank you. So, is that it for? I think we're good. Okay. So, are you good for me to go on? I think we've covered all of the questions that looks like we can cover verbally. Okay.
Yeah, looks like all the questions have been answered. So.
Okay, perfect. So just to review, our goal for today's webinar was really to assist you in nailing down which parts of Medicare you are contracting with, because this is an important first step in establishing your corporate compliance program. So we hope we've given you some good food for thought. Make sure that you are aware of where your program stands, and really knowing what the training requirements are is the next step. And so we've reviewed those as well, and if you go to your handout, you'll be able to review the information that we presented as well. The third step is implementing your knowledge. So we would encourage you to make sure that that corporate compliance and or fraud, waste, and abuse training is completed on an annual basis. And I did just allude to the handout. You should be able to see the handout on your webinar dashboard. So we would encourage you to open that up and either review it or go ahead and print that out so that you've got this information not only for your own use, but so that you can share that with members of your management team. So when you meet together, you can make sure that you are managing your corporate compliance program correctly.
Okay, great. Thank you, Michelle and Chad. This has been great today. If anyone has additional questions, we encourage you to please send us an email to support@hcp.md. And just remind everyone that our webinars are hosted monthly on the second Thursday at 1 p.m. Eastern Time. We will also publish this webinar on next week's Compliance Insider newsletter with a link for you to view it at your convenience. And we would also encourage you to take the time to take a survey today just to give us some ideas, some feedback of how we can better serve you as your compliance resource. So we thank everyone again for joining us and have a great day.